Posterior compartment of leg. Welcome to this video. In this session, you will learn about the posterior compartment of the leg. Key points include: the posterior compartment is also called the calf. It is the largest and bulkiest compartment of the leg. It contains strong anti-gravity muscles such as Gastrocnemius and Soleus. These muscles help raise the heel during walking and standing. We will also study its boundaries, surface landmarks, veins, nerves, muscles, and clinical anatomy. Let's begin. Posterior compartment of leg. The back of the leg is also called calf. It corresponds to the front of the forearm. It is bulkiest of the three compartments of the leg because it contains large, powerful anti-gravity muscles, such as gastrocnemius and soleus muscles, which raise the heel during walking. The posterior compartment of the leg is continuous superiorly with the popliteal fossa and inferiorly with the sole of the foot. Surface landmark. The bony framework of the posterior compartment of leg is formed by the posterior aspects of the tibia and fibula, which are joined to each other by the interosseous membrane. The bony framework of the leg is seen from behind to the tibia and fibula. Posterior aspect of the talus and posterior 1/3 of the calcaneus are also seen. The tibial condyle overhangs the shaft of tibia posteriorly, and at the sides, the rounded head of the fibula is quite inferior to the knee joint. The superficial fascia. The superficial fascia on the back of the leg and long saphenous veins and 7 cutaneous nerves. Superficial vein, short saphenous vein. It is formed at the lateral border of the dorsum of the foot, the lateral end of the dorsal venous arch, and lateral dorsal digital vein of the little toe. It ascends to reach the back of the leg by passing behind the lateral malleolus in the leg. It ascends in the midline, in the lower part of the popliteal fossa, where it pierces the deep fascia to join the popliteal vein. It drains the back of the leg, ankle, and lateral side of the foot. It is connected with the great saphenous veins and the deep veins. It is accompanied by the sural nerve on its lateral side, great or long saphenous vein. On the back of the leg, it is seen on posteromedial side, up to the knee. Cutaneous nerve. Saphenous nerve. It pierces the deep fascia on the medial side of the knee. It supplies the skin on the medial side of the knee. Leg and medial border of the foot up to the ball of the big toe. Medial cutaneous nerve of the thigh. It pierces the deep fascia a little above the knee. It supplies the skin of the uppermost part of the medial 1/3 of the calf. Posterior cutaneous nerve of the thigh. It pierces the deep fascia in the middle of the popliteal fossa. Descends with the small saphenous vein to supply the skin of the upper half of the intermediate area of the calf. Sural nerve. It is a branch of the tibial nerve in the popliteal fossa. It is joined by the sural nerve and a communicating nerve, which is a branch of common peroneal nerve. After passing behind the lateral malleolus, the nerve runs forward along the lateral border of foot and end in the skin of lateral side of toe. Lateral cutaneous nerve of calf. It is a branch of the common peroneal nerve in the popliteal fossa. It pierces the deep fascia over the lateral head of Gastrocnemius and supplies skin of the upper 2/3 of the lateral area of the leg. Medial calcaneal branch. Medial calcaneal branch of the tibial nerve perforates the flexor retinaculum and supplies the skin of the heel and the adjoining medial side of the sole of the foot. Sural communicating nerve. It is a branch of the common peroneal nerve, 1 inch below the lateral head of Gastrocnemius, and descends to join the sural nerve about 2 inches above the heel. It supplies skin of the posteromedial part of the lateral area of calf. Flexor retinaculum. The flexor retinaculum is a thick, broad band of the deep fascia on the medial side of the ankle. It holds the long tendons, vessels, and nerves in position as they curve and pass forward from the back of the leg to the sole of the foot. Attachments anteriorly or above. It is attached to the posterior border and tip of the medial malleolus. Posteriorly or below. Attached to the medial process of the calcaneal tuberosity. Structures passing deep to flexor retinaculum. From the medial to lateral side, these are tendon of tibialis posterior, tendon of flexor digitorum longus, posterior tibial artery and its branches, posterior tibial nerve and its terminal branches, tendon of flexor hallucis longus. Clinical anatomy: tarsal tunnel syndrome. If the tibial nerve is compressed deep to the flexor retinaculum in the osseofibrous tunnel behind the medial malleolus, it leads to a clinical condition called tarsal tunnel syndrome. Clinically, it presents as burning, tingling, and pain in the sole of the foot. Posterior compartment of the leg. It is the largest osteofascial compartment of the leg. Boundaries and subdivisions. Anteriorly, by posterior surfaces of the tibia, fibula, interosseous membrane, and posterior intermuscular septum. Posteriorly, by deep fascia of the leg, extending from the medial border of the tibia to the posterior intermuscular septum. Contents in posterior compartment of the leg. Superficial group muscle are Gastrocnemius, Soleus, Plantaris muscles. Deep groups muscles are Popliteus, Flexor digitorum longus, Flexor hallucis longus, and Tibialis posterior muscles. arteries, tibial arteries, and peroneal arteries. And nerve is tibial nerve. Muscles of the posterior compartment of the leg, superficial muscles on the back of the leg. Gastrocnemius muscle. It is the largest and most superficial muscle of the posterior compartment. It consists of two heads, medial and lateral, origin, medial head, popliteal surface of femur, above medial condyle of femur, lateral head, lateral aspect of lateral condyle of femur, insertion, the fleshy bellies of the two heads descend and inserted into the middle of the posterior surface of calcaneum. Nerve supply. Both heads are supplied by the tibial nerve in the popliteal fossa. Actions. It is the chief plantar flexor of the foot at the ankle when the knee is extended. It is also a flexor of the knee. Soleus muscle. It is a multi-pennate muscle lying deep to the gastrocnemius. It is so named because of its resemblance to a sole, which is a name of a flat fish. Origin. It has a horseshoe-shaped origin from back of the head and posterior surface of the upper 1/4 of the shaft of the fibula, soleal line, and middle 1/3 of the medial border of the tibia. Tendinous arch between the tibia and fibula. Insertion. The muscle fibers slope downward to form a massive belly, which gives rise to a tendon. Posterior surface of calcaneum as Tendo calcaneus. Nerve supply. It is supplied by two branches of the tibial nerve. The first branch supplies the muscle in the popliteal fossa from its superficial surface. The second branch supplies the muscle in the posterior compartment of the leg from its deep surface. Actions. It is a plantar flexor of the foot at the ankle. Plantaris muscle. It is a small muscle with a short belly and long, slender tendon. It lies between the gastrocnemius and soleus. Origin. It arises from the lower 1/3 of the lateral supracondylar line. Insertion. Its tendon blends with the medial margin of Tendo calcaneus. Nerve supply by tibial nerve. Actions. It has an insignificant role, either as flexor of the knee and plantar flexor of the ankle. Deep muscles on the back of the leg. Popliteus. It is a thin, flat, triangular muscle, which forms the inferior part of the floor of the popliteal fossa. Origin. From the deep anterior part of the popliteal groove on the lateral surface of the lateral condyle of the femur. Insertion. The medial 2/3 of the triangular area above the soleal line on the posterior surface of the tibia. Nerve supply. The Popliteus is supplied by a branch of tibial nerve. Actions. It unlocks the locked knee by rotating the femur laterally during initial stages of flexion of the knee. Flexor digitorum longus. Origin. Upper 2/3 of the medial part of the posterior surface of the tibia below the soleal line. Insertion. Muscle inserts into bases of distal phalanges of lateral 4 toes. Nerve supply by tibial nerve. Action. It plantar flexes lateral 4 toes. Flexor hallucis longus. Origin. This muscle originates from the lower 3/4 of the posterior surface of the shaft of the fibula, behind the medial crest, and also from the adjoining part of the posterior interosseous membrane. Insertion. Insertion takes place over plantar surface of the base of distal phalanx of great toe. Nerve supply by tibial nerve. Action. It plantar flexes great toe. Tibialis posterior. Origin. The origin takes place from the upper 2/3 of the lateral part of the posterior surface of tibia below the soleal line. Posterior surface of the fibula, in front of the medial crest. And also from the upper 2/3 of the posterior surface of the interosseous membrane. Insertion. Inserted chiefly on tuberosity of the navicular bone. Nerve supply by tibial nerve. Action. It's an inverter of the foot. That's a wrap on the posterior compartment of the leg. Now you know its muscles, nerves, and key clinical points. Thanks for watching.